we start.
Welcome to the Holistic Kids Show. My name is Zane.
My name is Abdullah.
And mine is Imad.
We're the Holistic Kids, here to educate us kids from the inside out.
Also, parent to divorce, 1 in 5 high school students have been bullied at school. 1 in 6 experienced cyberbullying.
Child trauma occurs more than you think. More than 2/3 of children reported at least one traumatic event by age 16.
That is a lot of kids.
Yes, and it doesn't stop there. Adverse childhood experiences are linked to chronic health problems, mental illnesses, and substance misuse in adulthood. However, ACEs can be prevented.
Preventing ACEs can help children and adults thrive and potentially lower risk for conditions like depression, asthma, cancer, and diabetes in adulthood.
So how are we going to do that?
Well, today we have the perfect person to talk to us about that today, Dr. Aimie Apigian. Dr. Aimie Apigian is a double board certified physician and leading expert on the biology of trauma. With 2 master's degrees in biochemistry and public health, Dr. Apigian is an authoritative voice in the intersection of functional medicine and trauma therapy. With a vision to help 1 million individuals accelerate their trauma healing journey, Dr. Apigian aims to bring the biology piece of trauma work to every single medicine and mental health education system globally by 2041, which is a long way from here.
Yeah,
but it's an amazing dream, an amazing goal that everyone should be working towards too. So thank you so much for joining us today. We would love to know your story.
Well, thank you. Thank you for having me. It's an honor to be here, and I'm very excited to have this conversation today. And, speaking of how many kids are affected, that is actually how I got into even studying this and being interested in trauma, because I was relatively unaware of it, had never really thought about it in my lifetime. And I went off to medical school, and it was during medical school that I chose to become a foster parent. And then I adopted Miguel, and he came to me when he was 4 years old. I adopted him just around his 5th birthday, and he had had a lot of trauma in his lifetime. And I set on a journey to find what he needed in order to help him be happy, be healthy, and rise above the pain and the trauma that he had had in his lifetime. And once I had that experience and I learned all of that, then I started realizing how many of my patients were affected by emotions and their past, and realized that I needed to learn how to help them with that piece of their disease. And it eventually has led me to what I do now, which is lead people through courses to do just that, to address how their biology has become affected by their trauma and their background, and how to safely guide them through a trauma healing journey, integrating a number of modalities that I have learned.
So let's start with the basics. What exactly is trauma?
That is a great question. And I'm so glad that you're asking that as a place to start, because most people, especially kids, would never even know really how to define trauma. There is a difference between stress and trauma. So if I were to ask you, what is a stress, what would you tell me?
Your body's way of responding to dangers.
Things that are happening around you. Stress can be good as well, right?
Ooh, I like this conversation already. This is fun. So yes, there is a stress response, and it doesn't have to be anything bad, because we can have a positive stress. In fact, every time that we go exercise or we go on a hike, that is actually stress to our muscles. But it doesn't break us, it grows us. And so stress is just a state of our body in response to a challenge. Now, sometimes that challenge is not a positive challenge, but it is a danger. But as long as we can stay in that place of this is a stress, we can learn from that stress, whether it's a positive stress or whether we would consider it a dangerous stress. stress is something that we can learn from.
Yeah.
That is not trauma. Trauma is something that overwhelms us. It makes us feel alone. It makes us feel lost. It makes us feel confused. And we don't learn from those experiences. So the difference between stress and trauma is that word overwhelm. Anything that we can learn from and stay responding to, that is going to be a stress. Anything that overwhelms us and we just kind of shut down, maybe even our brain thinks about other things because it can't focus on the present moment and what's happening, that is a trauma response of the body because it's a response of overwhelm.
Yeah.
So if you guys started the conversation around even bullying. So bullying at school, there can be two different responses to that depending on each child. So one child can experience bullying and it can be something where they feel stressed by it. It's definitely feels dangerous, but they feel that they have someone to go talk to. Maybe they feel safe talking to their teacher. Maybe they feel safe talking to their parent. And so it's something that they can take action and they can grow and learn from that experience of how do I navigate this problem that I'm having with this other student. But what if a child doesn't feel safe talking to their teacher? What if that child doesn't feel safe opening up and sharing that with their parent? Rather than feeling like they have support, they're going to feel alone, they're going to feel lost, and they're going to feel overwhelmed and not know what to do. And instead of being able to respond in a healthy way, they internally shut down. And that would be a trauma response. And so everyone can respond in two ways to life experiences. And we see this in every single family. We see this in every single life event where some people respond with a stress and they grow from that experience. And another person going through the exact same thing, for them and their body, they get overwhelmed and their body has a trauma response. And that has a lot of downstream effects on their health when it's a trauma response. Does that make sense? The difference
Yeah.
between stress and trauma?
So
Yeah.
basically, trauma is just a more severe version of stress. Like when stress gets out of hand.
And it gets really overwhelming.
Yes. So I like to think of it as capacity. And so I don't know, I have my drink right here. I've got some tea. And this cup, there's a certain capacity to the cup. I can only put so much tea in this cup.
Mhm.
If I overflow it, I've exceeded my capacity. And so I have a capacity for stress. And this is how much stress I can handle today and not break.
Mhm.
But if I put in more stress or I'm exposed to more stress than what my cup can handle today, oops, I get overwhelmed and my body breaks and it shuts down and it goes into a trauma response.
Yeah.
Mhm.
Yeah, and I think that's really important to understand because most people, when they think of stress, they think of it like just everything, like and stress. They think about the same thing, but they're two different things, which is very important to understand. I think, especially if we want to understand our health.
Yes. And the other important distinction between stress and trauma then is that stress is something that we can take action
Hmm.
and we're
Mhm.
responding to it, right? Like in the case of bullying, you're able to go and tell your teacher, you're able to go and tell your parent, you can do something about it. Whereas trauma, most people just kind of stand there or sit there and they don't know what to do. They don't know how to do it, or they don't have the energy to do it. They internally feel that no matter what I do, it won't make a difference. And so I'm not going to do anything. And so people will think, just like you said, that sitting and worrying about their problems is stress.
Hmm.
But no, that's not true. If you're not able to take action, that means that you've become overwhelmed and your body is actually having a trauma response. And that is very different than a stress response.
Yeah.
Mhm.
So a lot of kids nowadays are probably finding it really hard to share if they have if they are experiencing stress or trauma, especially because when they do try to express what they feel about it, then the parents are like, "What do you mean by stress and trauma? We used to just deal with it. What do you mean you're going through all this stuff?
Like you're just a kid. You don't understand any of the stuff.
Yeah, what is all this new stuff? Just deal with it." And so, what would you say to that? And how can kids deal with that? And how can parents deal with it?
That's such an important distinction between maybe some of the older generation where you are exactly right. That was their mentality and that is how they survived. They survived by just pushing through. They survived by just dealing with it. But
Yeah.
when we think of dealing with something, are you actually really dealing with the emotional aspects of it, or are you just pushing the emotions down so that you can do something? And usually it's we're
Yeah.
pushing the emotions down, right? Like
Mhm.
stop
Get out.
feeling, stop crying, and just pull yourself together.
Mhm.
Yeah.
But when we pull ourselves together at the expense of not actually feeling those feelings get stored. And it's almost like we have a box inside of us. And if we don't know how to feel those feelings or we're not able to, they get stuffed inside that box. And who knows when we will open that box again. But if we don't open the box and the more emotions and feelings that get stored in that box, the sicker it will make us over time.
Mhm.
And so how would a kid be able to talk about this if that's the message that they're getting? And this is where it's so helpful to be able to even have the words to say, and my feelings are important, and I want you to be able to help me with my feelings. And oftentimes when we say that to adults, they get it. It clicks. They're like, "Oh, that's right. You're a child. You don't know how to do this yet. And actually, as the adult, I'm supposed to teach you how to do this. I'm
Mhm.
supposed to teach you and give you the path and know how to feel your feelings in a healthy way so that we're not acting out on them, but yet we're also not neglecting them."
Yeah.
And what we find is that when we are able to express that and have someone validate, yes, this is what you are feeling right now, even just that validation helps us feel better and often gets us out of the overwhelm. And then we feel like I've got someone on my team.
Mhm.
And
Yeah.
as
Exactly.
long as we feel that someone is on our team, we can usually stay out of the overwhelm and stay feeling connected and safe enough to share with that person what's going on in our life.
Yeah. It's so important to share with someone else so you don't feel
Mhm.
like you're by
Yeah.
yourself.
That's exactly it. That
Mhm.
is when trauma happens, is when we feel we are all by ourselves.
Mhm. So we don't want trauma.
The
No, we
trauma.
don't want trauma.
So now let's get to the point. For a lot of people that don't understand trauma, they probably think that once a traumatic event happens, then you just remember that event. But what happens to the body when you experience trauma, and how can that carry on throughout your life? So, what's the side effects of trauma?
Yes, great question. And I'm going to answer that question first by asking you guys a question.
Mhm.
And
Mhm.
that question will be, when you think of trauma, do you think of an event in the past?
I think when I think of it, I think it's like when someone gets hurt or someone's get bullied or maybe a
Mhm.
family, then they always remember, I always got hurt and I always have like
Mhm.
flashbacks, right?
Yeah.
Yeah. So, what we want to change is actually thinking of trauma as something that happens inside of us rather than outside of us.
Hmm.
And so, trauma is a response of the body. And what happens is that when we don't know how to process that in the moment, then that experience stays with us inside of our body. And so
Yeah.
trauma is not something that actually happened in the past. It's something that is still happening inside of my body because I still feel all alone. I
Mhm.
Yeah.
still feel lost. I still haven't been able to have that safe person that I can share this with and have them help me move through this experience and these emotions. And so it's not something in the past, it becomes what I live with right now, and it's happening inside of me. And that's why it changes our biology. And that's how it becomes diseases over time. You guys mentioned in your introduction the adverse childhood experiences study. That
Mhm.
is a number of studies now that showed that what we're talking about is stress that became a trauma for those children. They didn't get sick right away. They got sick when they were an adult
Yeah.
because those experiences stayed with them. It changed their biology. And so, even as an adult, that trauma response is still happening in their body. So, the trauma is not what happened to them in the past. The trauma is still what is happening inside of their biology in their body.
Yeah, and I think that's amazing for people to understand because then it changes your entire perspective on how you view trauma and stress.
Mhm.
Yes, so many people are thinking, "Oh, I need to do more self-care because I'm so stressed." Not realizing that no, we're not dealing with stress anymore. We're actually dealing with trauma in the body. And that's going to take more work. It's going to take more deliberate work
Yeah.
because it's not just going to be, "Oh, go take a bath, go take a walk in nature and you'll be fine because it's stress." Once we have stored trauma, it's going to take more work because it's a deeper level than stress.
Mm.
So how can we, now that we know what stress is, how can we heal our stress in a way? How can we start to how can kids, start to make an effort to make sure that their trauma and their stress is controlled and so it doesn't, get bigger and get worse?
Mhm.
I love that we get to share this with other kids because I feel like this is what will change their life and
Yeah.
actually help them have a better childhood. Once people get to be adults like me and your mom, it's going to be different. But for you kids, there's something that is going to be very simple, but so important to do.
Mhm.
And what is the most important thing to do is for you to know how you feel loved.
Yeah.
Mhm.
What is it that someone does with you or for you that gives you that feeling inside your body that you are safe with them? It's very interesting to see the studies on trauma that the most important protective factor for kids is having an adult that they feel safe with. But most kids have never actually thought about, well, what makes me feel safe? And it's going to be different for each person. And that's why I would like you to know. So, even just with you three, it might be different across each of you. And so, let's figure that out right now. Let's do a little exercise and figure that out.
Okay.
Good idea.
When each of you thinks of feeling safe, and I want you to just imagine that for a moment, feeling safe. What changes inside of your body? I'll tell you that for me right now, just talking with you, when I think of feeling safe, like what does that feel like? And I even go back to a specific time where I know that I felt safe with this person. She's my Mexican mom, and I feel safe with her. And when I think of being with her, my shoulders drop and my stomach just feels like it softens and it gets warm. And that is how my body changes right now, just with thinking about feeling safe.
Mhm.
So let's start with you, Abdullah. How do you?
Well, I think even for all of us, it's probably our dad. We had,
I
and
don't think you should be answering after all.
I mean, because okay, we
That's
had it.
right. Thank you.
We had
I
it
want
figured
this to
out.
be each one of you. So each one of you, and we're not talking about a person right now. We're just talking
Yeah.
about your body. So I shared that my shoulders come down, my belly softens. Oh, I just got a deep breath there as I thought about feeling safe. So as you think about feeling safe, what do you notice right now in your body? What is one sensation that you notice in your body changing?
Um.
I'm more
Maybe.
calm.
Yeah.
Calm. Ooh, I like that. And where do you feel calm in your body? Where do you experience that feeling of calm? Is it in your stomach? Is it in your chest, your head?
For
Where
me,
does
it's
it
my heart.
your heart feels calm? Mhm.
Or my
Yeah.
I was my
shoulders.
mind. Drop.
Your mind, yes. And your mind, does it also feel calm or does it have a different sensation?
It feels calm.
It feels calm. The thoughts maybe slow down a little bit, not as racing.
I feel warm,
Warm. Where do you feel warm?
just like
This house makes us feel warm, right?
No,
well,
it needs to be
it's
something
actually
in his
not
body.
in this house. No, it's just
The body temperature.
the body.
Temperature.
Your whole body, or is there one area more than another?
I think the heart actually for me.
The heart feels warm. Yeah, that's a very common place for people to feel warm when they think of feeling safe. Yeah, I love that that happens to you as well.
Mhm.
So, this is how your body feels safe.
Hmm.
Feeling safe is not something that we can tell our brains and our body automatically follows. Our brain has logic, but our body has sensations, and those can become disconnected. And so we can go through life thinking about everything, but not actually feeling anything. And so knowing how our body feels when it feels safe, now when you are in a situation or with a person and you get that warmth in your heart, you know that, oh, when this person does this thing with me or for me, I feel my body feels safe with them.
So it's
And maybe
being
that's,
good.
yeah, maybe that's going out and doing something with your parent or a friend, or maybe that's when you get to just sit next to them, or maybe it's when you eat a meal together, maybe when it's just with them talking to you and looking into your eyes. For each person, it's going to be something different that makes them have that feeling in their body of, I feel safe with this person. And for a kid to know that, that is gold, because when they don't get that feeling, that's very important to know. I would not feel safe right now sharing something important going on in my life.
Mhm.
But when I know what it feels like in my body to feel safe, I know this is a person, and in this context, that I would feel safe sharing something really important to me.
Mhm.
Yeah.
Yeah, I think that's amazing for
Yeah,
kids to understand. You are so empowering.
very
So
empowering,
empowering.
Well,
inspirational.
it's very, I mean, I like to think of is that I'm empowering you guys,
Yeah,
right? Like
you
I'm
are.
giving you the skills for you to read your body, right? You get to read your body, read the messages from your body and know, do I feel safe? And how do I know that I feel safe? How do I know that I don't feel safe? Because when I don't feel safe, then I can do something about that. I can think of, well, what would help me feel safe right now? Do I need to go spend some time with my mom? Do I need to just go sit next to her even though she's taking care of the baby? Just sit next to her, because I know that when I do that, my body loves it and my body feels safe, and that's what my body needs to feel right now.
Yeah, and it's so amazing your concept of safety because a lot of
Mhm.
people think of safety, maybe like the police or like, maybe just the
Or
law or the government
locked
or just a
room,
locked room or a locked
a
door. But
locked
really,
room.
it's that feeling in your heart, in your body.
I really love
Safety, warmth.
Yeah, and that's the power that we each get to have, is that no matter where I am, whether I'm in school or whether I'm walking home or whether I'm with a friend at a sleepover, I can actually learn how to create that felt sense of safety inside my own body. And you guys did it just now with me, just thinking about feeling safe. And
Mhm.
it created that sensation in your heart, in your body, in your mind, calming it down. And so sometimes when we start to feel anxious, we can pause and we can say, I have the ability. I know how to create this different sensation for me of feeling safe, and I can do it right now. I don't need to wait until later. I can do this for myself right now by just stopping and thinking about feeling safe and a place where I've been or a person that I've been with that feels safe to me.
Mhm. Yeah, that's amazing how you can just say the word and Your body
and
just
watch your body follow. Yes.
You can't just say you have to think about it too.
just
Yeah, and that, we talk about the mind-body connection. You guys have talked about that a lot on your show. You talk about that a lot on your show, and this is how we do that. This is part of that mind-body connection, and a trauma will create a disconnection between our mind and our body. And so part of healing from trauma is repairing that connection. And after trauma, the body feels so awful. The body feels scared. It feels alone, like we mentioned. And we don't like to feel those things.
Yeah.
And so our mind says, you know what? Let's not feel our body. Let's stay up here in our head thinking about everything so that we don't have to feel that stuff down there in our body that feels so awful. And so part of the process of repairing that connection after trauma is, especially as a kid, going and being with someone with whom you feel safe, and they can help you connect with your body and feel those uncomfortable feelings so that we can reconnect our mind and body and not be afraid of feeling our body again. And then once we have that connection repaired, well, then we can go back and we can use our thoughts to say, I am going to think about a time that I have felt safe, or I'm going to think about a time that I have felt joy. I'm going to think about a time that I have felt just connected with someone. And when you think about that, you can notice the changes that happen in your body. And that's when we can put our attention on that. So, for you, for example, right? Like it made your heart warm, or for you, it made your mind feel calm. And we can notice that and enjoy that sensation and really pay attention to, what does that feel like to have my heart feel warm? And that way we're using our mind, and we're putting our mind's attention on our body, and that's how we repair that connection if we have experienced trauma, when that has become disconnected.
Yeah.
So, what is one thing kids can do today if they have dealt with trauma?
So important. So we talked about trauma being an experience of overwhelm. Overwhelmed and feeling all alone and scared. And so one of the most important things for a kid to do would be to talk about that with an adult with whom they feel safe.
Yeah.
And go to that adult and say, I'm still having feelings of being alone and being scared. Will you help me with those feelings? And that would be the most powerful thing that a kid could do, is to actually be brave enough, because that takes bravery, right? Can you imagine saying that to someone? That is so brave to say those words, because it feels vulnerable. Like, what if they don't help me? What if they don't know how to help me? Those are the fears that we experience when we are faced with, I want to share this with someone. And yet, as a kid, finding someone with whom I feel safe enough that I can go and share, I am still experiencing feelings of being alone and being scared. Can you help me with those feelings?
Yeah.
The other thing that I'm saying without saying it, but I'm separating the feelings from me. So I'm not coming and I'm not saying I am alone and I am scared, because that's not my true self. That's not your true self, but we can have those feelings sometimes. And so that's the language that I have chosen to have, is that I can have a feeling of being alone, but that doesn't actually make me be alone. I can have a feeling of being scared, and it's not me. And so that would be the language that would also be helpful for kids to develop, is separating me and who I am from a feeling that I'm having.
So, what would you say to someone, that's dealing with maybe bullying or some other traumatic event, and they've already talked about it, but they don't know what to do after that. If they talk about it to someone, they're still dealing with bullying. So, should they try to escape the situation, or what's the next steps for them?
The safety is the most important thing.
Yes.
And when we don't feel safe and it feels inescapable, that's when our body will go into a trauma response.
Yes.
And so, as long as I feel like I can escape, then it stays a stress.
Hmm.
And so, each person, each child would be able to decide, does this feel too big for me to be able to deal with that I should escape? And, or is this something that is, that is something that is not that big that I can tolerate it and I can get through this. But if it feels too big, then escape. By all means, escape. And whether that means running away, whether that means however we escape, because that safety is what the body needs. And this is where it's so important to bring in adults and other people so that we can create that felt sense of safety and be able to live our life safe. We want to be able to go to school and feel safe. We want to be able to go out on the playground and feel safe. And if I'm afraid, then that's going to shut me down. It's going to
Hmm.
prevent me from actually being able to play because I'm watching over my shoulder of, is this person coming, or I have to keep my guard up. And
Yeah.
so again, knowing what it feels like to feel safe in my body, that warmth in my heart, I'm looking to have that sensation. And if I don't have it, what do I need to do to create that sensation for me? Do I need to go to a different place? Do I need to go to a different playground? Do I need to stay by the teacher? What do I need to do in order to create and have that sense in my body that I now know of that tells me my body feels safe?
Yes.
This was amazing.
Amazing.
So, thank you so much, Dr. Amy. We know you're incredibly busy, so your wisdom today is a huge blessing for all of us.
Thank you so much.
So much.
So much.
Thank you, guys.
Let's recap Dr. Amy's key points. There is a difference between stress and trauma. Stress is something we can learn from. Trauma overwhelms us. It makes us feel alone, and we don't learn from those experiences. The difference between these is overwhelming. Trauma feels like we're all alone, but your feelings are important. Express your emotions and feelings to your parent or someone you can share it with. If you're feeling alone, you should address it and have someone validate it. That validation can help us kids feel better, and we feel like sometimes someone is on our team. That can really help us stopping from being overwhelmed, because now we don't feel alone, and we feel like there's someone with us helping us.
Trauma is a response of the body. When we don't know how to process that in the moment, then that can stay with us for a long time and make us feel sick. Trauma is happening inside of you and can become like a disease over time. These experiences can change our entire biology, and trauma is not what happened to you in the past, it is what's happening in your body right now. It does take more work once you have stored trauma. You need to know how you feel loved. What is that someone do for you, and that makes you feel safe. The most important protective factor is with an adult that you feel safe with. Know what it feels like in your body when you feel safe. For us, in order to feel safe, we just took a deep breath, and that kind of resets your entire body so you can feel that warmth in your heart and actually truly figure out what you feel. Part of healing from trauma is to repair the mind and body connection. Notice the changes that happen in your body and get help today.
Wow, Dr. Amy, that is amazing.
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 We are so thankful for your wisdom and time today. And thank you everyone for tuning in. Until next time, I'm Zan Ansari.
I'm Abdullah.
And I'm Elab.
Follow my family and I on social media, Holistic Mom MD, and look out for my mom's book. She's working on book 8. I'm doing the illustrations, and we're also writing a book. So there's a lot of stuff going on. Kids need to learn from other kids. Please download our podcast on iTunes and leave a review so other kids and families can benefit. We need to work together to create a healthy future for all of us and the planet. Join us next week for another episode of the Holistic Kid Show, where kids are empowering kids.
Thank you, everyone.